Hey everyone, thank you for joining us today. We'll be starting very shortly, but we just want to give a few more minutes to everyone to join. But in the meantime, I have a little joke for everyone. Why did the CrossFitter bring a bottle of Windex to the WOD? You guys are great. We got a lot of good responses, but the CrossFitter heard they're going to be cleaning. All right, so good afternoon. My name is John McCary. I'm a physical therapist and clinical director at the Spear Long Island City location. I would like to welcome back those of you who have attended one of our webinars before, and welcome those who are joining us for the first time. We appreciate you taking time out of your busy day to learn with us. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years. We currently have 21 locations located all over New York City. We have successfully continued to offer in-person care throughout the COVID-19 pandemic, along with launching Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of their own home. In our clinics, we have strategically gone above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information and our safety measures by visiting our website at spearcenter.com. We are here for you in whatever way makes you feel most comfortable. So if you're looking for individualized care, either in the clinic or through telehealth, please feel free to reach out. Today, we're excited to be with you and discuss low back pain in lifting and CrossFit injuries. We'll be presenting what research currently says about the best management for low back pain and why low back pain is common in this athletic population. Don't worry, this will not just be a lecture. There are going to be interactive portions, so make sure that we have a little bit of space to move around. As you can see, we are coming live from our own homes. So we don't anticipate any technical difficulties, but if we do, just please bear with us as we navigate it. A few more things before we get started. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know through the Q&A feature. To find where that is, please take a moment to hover over your mouse over the bottom of your screen, and you will find Q&A option pop up. That is where you can ask questions, and we'll do our best to address as many of them as we can during the webinar. It is best to put the questions in the Q&A section, because if you put the questions in the chat feature, we may not see them. For those of you who are watching through YouTube Live, we are monitoring those comments in that section also, so please feel free to reach out. Lastly, there will be times where multiple panelists are on screen. For the best viewing experience, please select Gallery View, which is at the top right-hand corner of your screen. So you'll be able to see all of us at once. All right, so let's talk about the goals of the day and what we'll be covering. So we'll start by outlining the current model of low back pain management in America, discuss the basic concepts of exercise and load on the spine, discuss basic movements commonly seen in lifting and CrossFit, and finally, review movement patterns and techniques during lifting and common technical faults that may lead to injury. So before we get started, I would like to introduce our team of panelists. Our presenters today are Martin Del Prado and Jillian Lye, both physical therapists at our LIC location. Lastly, we have Ryan Coy, who is also a physical therapist and clinical director at the Midtown Plaza Hotel location. He'll be helping us with the questions in the Q&A section. One last reminder, I promise, for best viewing experience, please select Gallery View so you can see everyone at the same time. If you've done that, you should be able to see all four of us right now. Okay, let's get started. Ryan and I are going to say goodbye for now. So Martin, take it away.
All right, so thank you for the intro, John. What's up, guys? Again, my name is Martin Del Prado. I'm really happy to be here with Jill tonight to talk about the mechanics of squatting and deadlifting and why these movements are important for all weightlifters, CrossFitters, and general population who want to learn how to squat and deadlift safely so you can get stronger overall. For the sake of time, we're mainly talking about lower back pain today. But if you have questions about another body part, maybe we can address that individually or during the Q&A section later. This is a topic that I hold pretty near and dear to my own heart, being someone who's been lifting for a while and I've had my fair share of lifting injuries. So I was deadlifting as a young athlete. I hurt my back, I freaked out, saw a doctor, got some imaging, took the pain meds, I rested, got weak. And after getting really frustrated, nothing really changed for me until I started using some of the principles that Jill and I are going to discuss here today. So I'm happy and excited to share those things with you guys tonight. And I'll hand it over to Jill in case you want to give the people out there a little intro.
Hi everyone, my name is Jill and I've only been lifting for 2 years. I started going because a friend invited me for like a free session type thing. And I go to Dutch Kill Fitness, which is here in Astoria, actually really near our clinic. And being a physical therapist, obviously I had some skeptical parts that I had in mind, but after doing it and understanding the movements better and having proper coaching, I realized like this is a topic that's dear to my heart after seeing a lot of my friends get injured. So yeah, I think Martin and I are going to cover a lot of things that are pretty essential today, and I'll pass it back to Martin, who's going to start, right?
All right, so ready to rock and roll. I'm going to kick us off with a little background and some random stats about low back pain in America and the sequence of events that probably goes down when you injure your back. All right, so good old America, 90% of Americans experience some sort of lower back pain in their life. Even crazier stat, $50 billion is used every year pharmaceutically just in the management of low back pain. And even crazier than that, 250 million days of work are missed every year just due to low back pain disability. So that's crazy. Somehow America is finding a way to work less and spend more money on medicine, which just makes no sense. So you would think with low back pain so prevalent in the United States that there's probably a good system in place to get rid of it, right? And unfortunately, that's just not the case. And that's kind of the issue that we want to talk and address today. So we're going to go over the sequence of events that happens in the older treatment model, what might happen today when you injure your back. And then we're going to talk about what's starting to become recommended in the newer treatment model going forward. So let's start with a made up scenario. Let's say that you hurt your back. It's atraumatic. So you didn't get hit by a car. No one kicked your back or a brick didn't fall on your back or something like that. It happened a little bit more organically. So maybe you were someone like me who was just deadlifting with poor form, or maybe you're somebody who was dragging a big bag of rice from your garage to your pantry, or maybe you're just working at home because of COVID, right? And you're just sitting a lot, or you just love Netflix. Season 2 of Outer Banks just came out, so you're just on the couch all the time. But either way, you have back pain and you kind of decide, oh man, maybe I should see a doctor now. So it's good. You saw a doctor, or you're deciding to see a doctor, But with all the information available out right now, chances are you're gonna like open your laptop or your phone, go on Dr. Google and say, what's wrong with me and how do I fix it? And it's gonna open up this whole can of worms on things that could be wrong. You're gonna get scared, you're gonna close the laptop and actually go see the doctor. So when you go see the doctor, some or all of the following could happen. The first thing that might happen is you might get imaging. 30% of the time this is recommended. And until you get the results, you might be told to take some pain medication, rest in bed, avoid all aggravating activities in case you might make something worse, which by the way, 30 to 60% of the time, opioids are prescribed on the very first visit. America, good old America, #1 in using imaging and prescribing opioids. Nice. So this is where the issue begins. When we get the imaging, there's going to be a little section on there that says abnormal findings. It's going to say all this stuff that you can barely understand, but it sounds really, really scary, like degenerating disc disease, disc herniation, disc bulge, et cetera, and all that's doing is basically feeding into all of the original fears that you got from Dr. Google a couple days before this, right? So at this point, your doctor might say, hey, bud, maybe it's time that you go see a physical therapist. So basically all of this behavior started because you got the imaging, you freaked out, and there's this huge cascading effect where now you're on pain meds, you're in bed, you're getting weaker every day, and now you're scared to move and you're scared because you don't know what's gonna happen next with your back. But the very cool thing that's happening right now is we're finding a lot more about imaging. So in the most recent research, we're finding that almost all people start to see abnormal changes on imaging just because of age. And this does not correlate with pain levels at all. So there's actually this huge research article out there that shows 3,000 asymptomatic people. And asymptomatic, meaning they don't have pain, they don't have symptoms, they all got their images, and there was a linear correlation, whichever way is correct, that the older you get, the more abnormal findings you might see on the imaging. So what you need to take away from this is that 100% of people in this study had abnormal findings, but also 100% of people didn't have pain, right? So that's really big. And in fact, there's more research that says there's only 5% of low back pain cases that are truly attributed to some pathoanatomic reason, like a fracture or something. So based on these findings and the imaging, we just can't rely on imaging anymore to dictate our plans of care. In fact, the most updated guidelines in managing low back pain, when it's not traumatic, is 1, do not get imaging. And it's recommended to see a healthcare provider who can perform manipulation, someone that can help you exercise, because in 100% of the guidelines out there, it says you need to exercise. There's also a bunch of research out there that says seeing a physical therapist sooner rather than later when you have atraumatic back pain leads to the best outcomes. So in short, from that whole rant, physical therapy is awesome. See a therapist as soon as you can after injuring your back. And physical therapy is becoming a tried and true first line of defense after an atraumatic back injury. So that's it for me. I'm going to pass it over to Jill. She's going to talk about why exercise is so important for the rehab process and what goes on in the body during exercise.
Hi everyone, I'm back. So all of you might or may not have encountered a physical therapist before. I actually have a lot of friends that don't know what I do. They think that we just massage people, but actually physical therapists are the exercise people and we are the exercise doctors. So similar when you go to a doctor for any sort of pain, they prescribe you medication. We as physical therapists, exercise doctors, we prescribe you exercise, right? So, and this, many of you who have been to physical therapy might know, like all you do is just 30 minutes or 45 minutes of exercise nonstop. And that's what is gonna help us get us better, all right? So this is awesome because exercise is like, in the latest research shown that it is the best treatment to back pain, and not only in prevention of current injuries, but not only in prevention of now injuries, but also like prevention of diseases moving forward. So what exactly is exercise, or what counts as exercise, and what types of exercise are safe for when we are having pain? I think that's the most important question, because when a lot of us are having pain, we don't want to move. We just want to lay in bed and drink some hot tea, right? So exercise actually requires loading. And what is loading? loading is providing a stimulus to your body, and this can be in the form of weight, all right? So when the body experiences a stimulus, an external stimulus to the body, it starts to change and it starts to adapt. So when you have pain, normally your muscles shut down because it doesn't want to cause more pain, and that's where the weakness comes in. And that's why we need to start moving as soon as we can. And when we do this and when we start loading the back, especially properly and carefully, it will cause the other muscles in the spine to also adapt to the change. And not only changes in daily function, it also helps it to get stronger. It communicates with other cells in the back to get stronger and to adapt to the amount of load you're putting through it. So this is why when we are having back pain, we can bend over, but as we do more movement, as we try to load the spine a little bit better, we get better at it. And two exercises are actually very, very good for lower back pain, and that is the squat and the deadlift. And you may have gotten injured from the squat or a deadlift, but they're actually, contrary to what people believe, the best way to really strengthen the spine if you have proper coaching and if you load the spine correctly, all right? So this is because they involve full body movement. And when we move safely with the right amount of load, it can really help to strengthen and make the spine more resilient. So now I'm going to pass it back to Martin, we're gonna start talking about the squat and the deadlift. He's gonna start with the squat and I'll continue with the deadlift, but I'll pass it back to him.
Wonderful, thank you, Jillian. All right, so do you want to get that? All right, so Jill's gonna go try to turn on another camera. And we're gonna get into the nitty gritty of the presentation, our technique talk with squats and deads. Again, I'll talk with squats, Jill's gonna talk about deadlifting, and we'll try to demo best we can the entire time for you guys. So for each, the squat and the deadlift, we're gonna try to do some things. So one, talk about the associated myths with the movements. So try to keep an open mind about these. Proper setups for the movements, things to think about when you're actually doing the movement, and some common faults that you might see or do. If we have time, we'd love to do some like self-screening tests, but only if time allows, maybe we can do that during the Q&A section. It's important to remember that for the squat and the deadlifts, cues to perform the movement might be similar person to person, but the setup might be completely different just because of anatomical differences. So after our little chat today, if you're still having issues with squatting or deadlifting, we would highly recommend that you see a physical therapist, a trainer, or somebody for further evaluation. So I want to start off with myths, right? So we're going to talk about two. Myth number one that you might have heard, squatting deep is bad for your knees. And I just want to debunk that real quick, just because you put a little bit more pressure and more torque around the knees when you squat deep, that doesn't necessarily mean that it's bad, right? That's like saying, like, I only do partial rep bicep curls because it's hard to do at the bottom, which no one said ever because everyone wants huge biceps, right? It's the same thing for the squats. Plus, the ability to perform a full depth squat is something that everybody should be able to do. There's actually way more pressure in the knee when you squat to just parallel and not go deep, because that's the point where there's a lot of force going behind your patella. So if you drop a little bit further, there's some weight taken off the knee just from the fact that your hamstring and your calf is kind of touching in the back. But when you stop it parallel, there's a lot of force and you're basically telling your knee to do all of the work. So myth number two is one that you've probably heard before. Do not let your knees go past your toes. And yeah, I don't know. But what happens when you don't let the knees go past your toes? Like, think about it. The fact that you probably can't drop into a full depth squat is just one thing. But think about normal life, right? If your knees don't go past your toes, you can't do so many things. Like, just try to even stand up out of a chair without your knees going past your toes, or try going downstairs or walking backwards, something like that. It's just impossible. So the concept of not letting your knees go past your toes in a squat is usually used as a cue when somebody wants to get the hip more involved. And it was a cue used before when people would squat. It was very knee dominant and people would lose their balance going forward. So yeah, we should be squatting deep. Our knees should be going over our toes. Not only has the full depth squat been shown to increase glute activation, but we find through research that there actually isn't that much more pressure in the knees when we do a full depth squat. And here's a stat for you. Squatting full with your knees going over your toes increases your knee torque by 22% compared to when they don't go past your toes. But when you squat with the knees not going past your toes, you actually increase the hip and lower back torque by over 1,000%. And we wonder why lower back pain is such a common issue when it comes to squat technique, right? So kind of pick and choose what you want. Do you want to put 1,000% more torque in your back, or just 22% in your knees? And if you load it properly, it is safe, right? So just for the sake of today, I know there are a lot of squats out there like goblet, front, high bar, low bar. But for today, we're going to generalize to the air squat. That way we don't have to talk about bar position or things that might vary person to person, or more things that might vary person to person. Each squat trains something a little bit differently, but the cues are very similar except for the low bar squat. So we're going to talk about the setup first. So Jill's going to start doing some stuff over there. When it comes to the setup, again, each person is going to be different just because of anatomical differences. And you'll probably hate me for just saying this because it seems so obvious, but the best setup will tend to be what just feels best for you, right? A good starting place though for your feet is about shoulder width apart. And then the next step you would do would be just to squat down into the deepest squat that you have, right? What's great about the body is that it's going to self-correct, and if it doesn't feel right, it'll tell you, right? So let's do an example. So I'm going to tell Jill to stand tall with a narrow stance. So just go ahead and stand really narrow, and I'm going to tell Jill, hey, look forward, keep your chest tall, and just drop into the deepest squat that you've got there. And for Jill, right, she has wider set hips. She obviously doesn't like that motion, right? So what I'll tell her to do is squat down deep. Go ahead. And now you're free to kind of choose the new foot placement that is more conducive to her hips, her body, and she can stand back up at this point, right? So kind of play with it a little bit, see what feels good for your body. The amount of rotation at the feet is, again, going to differ from person to person, but about 10 to 20% of degrees toeing out might be a good starting point just to play with. Just make sure that naturally when you bend your knee, the knee should track kind of over that second toe. And if it's falling inwards, then just adjust a little bit. Just try to find where it feels the most natural. If you're somebody with really stiff ankles and you don't really have good ankle mobility, or you have really long femurs, you'll see when I stand up later, it might feel better to have a wider stance with the toes pointing out a little bit more. But again, it's just something to play with. So we're going to talk about the actual squat now, the performance of the real squat. So first, it's the descent, right? So when you're descending into a squat, there are two cues that you can think about, and each one has its advantages and disadvantages. The first one is sit down, and the second one is sit back. I'm a fan of the first cue because naturally you have to drop your hips down between your heels. The knees will drive forward naturally. You can maintain a forward gaze and an upright chest. And otherwise, it better cues you automatically into a full depth squat. The exception is if you're a power lifter, where sit back might be a better cue. Since you're not really looking for full depth, you just need enough depth to get a good lift, right? So ideally, when you drop down into your squat, you should get your hamstrings to cover part of your calves with a good neutral spine. That being said, the first common fault that you'll see during a squat is called a butt wink, where the lower back rounds out a lot at the bottom of the squat. It's important to remember that some wink is normal, but too much, especially loaded, like Jill just has a dowel on, but imagine if you have like 200 pounds on, that could be an issue, right? So try your best to at least maintain a neutral spine, at least to the naked eye, the entire time. You can improve this fault by improving your setup, like maybe you have to have a wider stance so you can open up your hips a little bit more, by improving your hip and your ankle range of motion, or maybe just by improving your core strength. So play around with those and see if you can get rid of that excessive butt wink. So now we're in the bottom of the squat. So Jill, hold the bottom. Just hold it. Good. When you're ascending in the squat, you're thinking about driving through the midfoot, transferring as much energy upwards and into a bar if you're using one. So the core needs to stay tight, really, really tight, so no energy is leaked out, right? If energy leaks, that just means you need more force to push that bar up. Ideally, you're looking for your hips and your chest to rise together. So try to think about looking forward, or better yet, just not down, because where you look tends to be where your chest follows. So if you look straight, it's easier to keep a chest upright. Another fault that you'll see in the ascent of a squat is something we call a good morning squat, or I know it's been called a stripper squat in the CrossFit community as well, because the movement looks like a good morning, which is just a separate exercise, right? Where you can see with Jill, her butt is rising well before her chest. So what is happening here is that her quads might not be strong enough to assist her glutes in standing up. So you might see this more when you're squatting a little bit heavier. And how you're gonna fix this is trying squats where you are upright a little bit more naturally. So try some tempo goblet squats where the weight is in front of you, or you can try some front squats. Spending a little bit more time in those positions, developing your quads, doing split squats, or really anything to build up that quad strength. And yeah, hopefully we'll have some time for some self-assessments, but I'm gonna leave it for that for the squat. Jill and I are gonna trade places and she'll talk about the deadlift. 1 second.
Hi everyone, I'm back. So I hope you had some good information from Martin about the squat. So we're going to move to a deadlift and we're going to talk about the conventional deadlift. There are many types of deadlifts, sumos, whatnot, but the most common component in Olympic weightlifting and CrossFit, I think, is just the conventional deadlift. And you'll see this in a lot of your WODs too, right? You actually, the same movement goes for when you do dumbbell snatches, when you do dumbbell deadlifts, and the first pull in your cleans and in your snatches are all deadlifts. So let's talk about deadlifts and some of the myths that are surrounding it. So one very common one that I hear is that, deadlifting is bad for your back and that if you have pain, you shouldn't deadlift. So firstly, I would like to say that deadlifting, yes, a lot of people get injuries from deadlifting, but it's not necessarily bad for your back. If you think about it, we actually bend over all the time and picking stuff up. So I don't think the solution to that is to avoid the movement completely. We just got to modify it and just play around with what causes pain and what doesn't cause pain, just so that we can keep the spine moving. And the other common one I hear is that this deadlift is like a squat, but from the ground. And that is also false, because the deadlift movement cues are completely different from the squat movement cues. And you'll see that later when we go through the movements with Martin. And finally, one other one that I always hear is that I shouldn't be lifting from my back. The back is actually very resilient. It's actually very, very strong. And we use it all the time. Yes, we shouldn't be lifting solely from the back. We should use our backs and our glutes, but at the end of the day, the deadlift is training a lot of the back. So it's just about working around with load and ensuring that we have proper setup. So the best way to ensure that our deadlift form is good is from the setup, meaning from the get-go, from the start. We need to make sure that our alignment is correct, and then it sets us up for the movement later on. So let's go through that with Martin. So you can see it over there. It's much taller than me. His legs are way longer. So let's go through a little bit on the movement. We're going to start with the top, all right? So the neck obviously should be in neutral. So make sure it's not too hyper extended. So then you can start to get neck pain and you start to use your shoulders a lot. So make sure it's neutral, and your grip is actually shoulders width apart. This might differ from some people depending on whether your stance is wide or narrow based on your leg length, but generally the general rule is that it should be shoulder width apart. And the next one is really important. Starting from the mid-back, we want to keep the mid-back super tight. And that's not just like squeezing your back. It's squeezing your mid-back and also your lower back all together. So your mid-back and your lats, you pull your lats together, and how you do that is you bring the bar super close to your shin, and it should stick to your shin. It shouldn't be floating out. It should be directly over your midfoot, right? And you're gonna keep the shoulders directly over the bar. So Martin is gonna show you an example of how it's when it's too far behind, and too far in front. Yeah, it should be directly over. Let's give him a break. Okay. And how it should look: your shoulders over the bar, your lower back is below your shoulders, but above the knee, right? So it's shoulders, hips, and then knee. Your hips should not be in line with your knees. So show them in a back example. Yeah, it should not like that. And it should not be in line with your shoulders. So it should not start like that. Yeah, good. So these are generally like the main important parts. So the other thing is that we want to make sure our elbows are super long and straight, even when lifting. So when lifting, we do not want to use our elbows to, yeah. And this is really important because we want to make sure that the bar is super close to us. We don't want to start getting like tendonitis in our elbows and stuff. So that is very important. And let me show you some examples on how the movement should look like and how it should not look like. All right, so let's start with like maybe from the bottom going up, Martin. All right, so the cues you want to get, especially if you're doing really heavy deadlifts, is you always drive your heels into the ground. So you're gonna lift your hips up and your knees up at the same time, right? And we want to make sure that it's driving through the ground. Your chest and your hips should also rise at the same time. One example that we should not do is like rising one faster than the other, because it's going to put a lot of shear forces and compression in your spine. And we want to pull the bar towards your hips to neutral, so no hyperextending. And you see this a lot when people want to lift really, really heavy. They shift their hips out and they start to hyperextend. So stop at neutral. It shouldn't go any heavier than that. If you're struggling to get to neutral, then maybe just drop the weight, all right? All right, and then now we want to talk about descending movement. So from the top going down, we want to make sure we break at the hip first, and then we're going to slide the bar down the thighs, right? So Martin, and once it crosses the knee, we want to begin to bend the knee and set it to the ground. So going down, your deadlift should not look like a squat. It should bend from the hip first, going down. All right, and Martin is going to show you an example of a squatty looking deadlift, which should not happen. Meaning, can you see that the bar is actually traveling like over his knees? It has to travel past his knees, like around his knees kind of. And you think about it, if you're carrying a really heavy weight, you're actually not being very energy efficient here. You have to kind of maneuver a huge amount of weight around your knees, and you coming back out works the same, right? You have to maneuver it around your knees as well. So we want to make sure that the knees don't bend too early. And if they do so, this is really dependent on your leg length. If your legs are super long, you might have to just widen your stance a little bit to avoid that. And vice versa, if you're shorter, it's going to be shorter. Generally, it's easier. It's more of an issue if you're really tall and have really long limbs. So we want to widen that stance a little bit. All right, and the next thing we want to make sure is that the bar moving up and down is moving in a straight line. Like it should remain always in the midfoot, like right there. And it should not, I mean, there's a little bit of variation, but it should generally stay straight going up and down. And let's talk a little bit about why having a flat back in a deadlift is so important. You know, coaches always say, keep your back flat, keep your back neutral. Why is it so important? This is because when we are actually deadlifting, there's so many types of forces that are going through your back. There's like compression, there's shear. Naturally, your back has ligaments and things that are holding it in place, right? And that actually already provides a shear force on its own. And so if we don't engage, not just our core, we need to engage everything. Our lat is very important. Our lats, our back, and our core, all three at once in order to counter that force that it's already in the back caused by the ligament. So if we don't do that, there's just a higher chance of injury, especially when carrying a really heavy load. And we want to make sure that the load is as close to our body as we can. If we are having troubles sliding it up and down our legs, keeping it close to our body, then the best way is just to drop the weight and make sure that the movement is right before increasing any other weight. All right? Okay. I think that's all we have for like the deadlift movement. And Martin's going to join me right now. All right. Okay. So we're going to be ending off here just talking about injury rates, right? I think there's a common misconception that CrossFit is so, like, everyone is so injury prone at CrossFit. You guys do crazy lifts, you guys do all these crazy things, Olympic lifting. But actually, research has shown that CrossFit is not more dangerous than any other recreational sport. So that includes like running, cycling, soccer, basketball. It's not more. The exact number is 0.27 to 3.1 injuries per 1,000 training hours, right? But I think there is definitely a few things that make you more injury prone, and that is when sometimes we're not careful. One very big one is that if you had a previous injury to that area and you either did not do proper therapy for it or you didn't do any therapy at all, shouldn't be expecting to deadlift, I don't know, way past your body weight if you haven't even gone for any therapy, because once there's injury to the back, you definitely is going to weaken it, and if you don't do anything about it, it's not going to magically get better or strengthen on its own. So that's one big thing. Second one, unfortunately, male gender is way higher in terms of injury rate, only because it's just research shows that females are just a little bit more scared. They're very much more compliant to what the coach has to tell them, or rather would seek help from the coach. And that it has shown too. So if you're male gender, naturally the ego is going to come in, and that's when all the injury happens. Number three, which makes sense, is the years of participation. All of you who do CrossFit or lifting know that there's actually a huge skill component to it. And obviously, going through all that movement, there's a lot of technique involved. And it's not as simple as just lifting it and putting it down on the ground. It's actually a lot of movement that you need to be careful of, and you need to make sure you're doing it right. So you're loading the spine carefully. And I think with more years of experience and with more years of feedback and people telling you how to correct that, generally you would be better at someone who just started off a month ago. So that is another risk factor. The last one is actually really important. If you're training less than 3 days a week, or if you're training more than 6 days a week. Less than 3 days a week, meaning you look at the WOD, you're like, I don't want to do, I don't know, dumbbell deadlifts, and then you skip the WOD. A lot of the WODs are meant to strengthen and prepare you for the heavier lifts. So a lot of these strengthening parts of the WOD that are not, maybe you're like, I only want to do barbell, I don't want to do dumbbell. But actually a lot of the dumbbell stuff can really strengthen the other parts of your body that require for you to do a very good barbell movement. So I would say don't cherry pick your workouts. Make sure that you're going at least, the sweet spot is 4 to 6 times a week. If you're going more than 6 times and you're wondering why you're getting injured, it's probably something due to the training load. So going too hard 6 days, you just need time to recover, and you're not giving your body enough time to recover. So yeah, I think those are the main risk factors. Anything to add in?
I think, yeah, kind of like what Jill said. There aren't bad movements out there. It's really bad cueing, bad coaching, bad programming, right? So you should be able to squat, you should be able to deadlift, you should be able to do really any of these motions that you're doing in the gym, but you should be doing them safely, programmed well. Yeah, that goes for a lot of exercises out there.
Yeah. So let's talk about, I think, some ending key points. So we're gonna end up with some key points. And this is really important because I feel like I've spoken to a lot of people that I know that they have some sort of pain lifting and they think it's normal. It's not normal to have pain when you're lifting. You should be feeling no pain. I mean, muscle soreness is not equivalent to pain. Muscle soreness is the muscle trying to recover. But if you're getting actual pain, especially when the lifts get heavier and heavier, I would say don't ignore the pain. And the pain is really vital information. It could mean some mobility issues, like what Martin was talking about, like ankle mobility that's causing you to load your back way more than it should. Some stability issues and poor core control. So like going down the squat, it might not be very controlled. The core's not kicking in. Excessive loading, meaning doing too much. You're seeing other people put more plates on the barbell. You want to put more plates on the barbell, and you know obviously you're going to strain yourself. And then insufficient recovery is one big one. So not letting your body recover. But I would say if you have any of these pains, just make sure you seek professional help. A physical therapist should be able to identify whatever restrictions or issues that you have and that you could work on so that you have more pain-free movement. And this, of course, is going to include other types of exercises that's going to help you incorporate that so that you can get a better lift, pain-free lift. Do you have anything?
I think that was it. I think we're ready to throw it back to John. John, come back on screen, man.
Wow, awesome job, guys. That was really good. A lot of information I think we could all benefit from. So during this time, we'll answer a few questions that we got on here and also on YouTube Live. The first one that we got, I'm going to use my poetic license to ask this. I struggle with full range of motion squats due to poor ankle mobility. I also have plate and screws in one ankle due to a previous ankle break. Should I not be squatting if I cannot even bring my hips to knee level? Some more information is my squat depth is shallow. I can squat to a 24-inch box.
Do you want to start? Let me start.
You can start.
I would say that the first thing to think about are like goals. So if you're like a weightlifter, sounds like you're a weightlifter, then yes, you want to be squatting. And if you can squat to some degree, then you should be, or else you're going to lose a lot of that glute and quad strength that you have available in whatever squat you have right now. There are ways that you could work around if it's just an ankle, even with plates and screws in the ankle, there are ways we can work around that. Like I was saying earlier, if you have bad dorsiflexion or stiffness in the ankles, really tight calves, you might benefit from just widening your stance a little bit on the squat, turning the feet out. That does require a little bit more hip mobility, but it's one way to work around the ankles. Another way that you could do it, if dorsiflexion is the pure restriction, elevate that heel. Elevate your heel. It puts it in a different range of motion. So you start in a little bit more plantar flexion. So when you go down, you don't have to achieve as much dorsiflexion. Along the way, you don't just use these in order to squat deep. You should still keep working on your mobility and don't just rely on those things. But anything to add?
Want to talk about the squatting to the 24-inch box?
You
can. The question is, if you're could you repeat the second part of the question, John?
I think it was just reference for how deep of a squat they can get to.
All right. I would say if you start from a higher, you can just keep modifying it till you get lower, like just modify using your box, like slowly you can kind of gauge. But one thing I think one thing that's important is to make sure that as you are decreasing the height of the box, you want to make sure that your legs are actually, your knees are actually translating forward. So don't just keep sitting back. You want to make sure that your knees are actually passing your toes and that you're loading the knee appropriately and getting that dorsiflexion. That's just one thing to note.
You guys mentioned elevating your heels. What would you use in the gym to do that?
Easy one or plates. Plates, usually like a 2.5 or a 5-pound plate. I wouldn't go, I've seen people go heavy, like more than that. But I usually stick around like the 5 or 10-pound plate. Yeah.
Or lifters.
Or lifters, yeah. I mean, well, yeah.
Thank you. Awesome job, guys. So the next question is, should I use a belt while performing these exercises?
I'll start. Yeah, I mean, the belt is there for, if anyone doesn't know, the belt is there so that we can increase more pressure around the spine so that we can brace it a little bit more so that it's safer under those heavier loads. It's important to use a belt if you are really training at a high weight, high intensity, like 90%, 85, 90% over. But if you're not training at that intensity, then if you're training at like 70, 75% of your 1 rep max, I don't think it's necessary to wear a belt, especially if you're not going for max reps. But if you're putting yourself in a situation, deadlifting or squatting, where you're anticipating max effort, putting a belt would be a good idea just for safety.
Yeah, I would say don't don't think that you have to use the belt all the time, because then you're really losing like the purpose of the exercise, which is to train your core and your lumbar resilience. So if you're finding for like 70% lift you have to use the belt, then you shouldn't be you shouldn't be training at that weight. You should drop the weight. Yeah.
So do you have a recommended technique to drop the weights after exercising to reduce risk of self-injury?
There's a technique. I feel like you'd be more versed.
I don't think okay, first of all, the person that would probably know the best is the coach that's actually watching you. I feel like if they're looking at you and they're telling you that's too heavy, then you should take that as a cue to drop the weight. For me personally, if I'm struggling to even get good movement, I would drop the weight. And for me, that's just me. I haven't had any injury from CrossFit. I feel like going lighter is always a safer way. And yeah, if you feel like that's too easy for me, cool, like at least you got to work on proper movement and you're not like struggling through the movement. So I think that's one big cue to note, that if you can't even like, one other way is to actually video yourself when you squat. So I didn't know that I was actually lifting my butt first in a lot of the heavier squats, and so that's when I know, yeah, maybe I should drop the weight, and just to make sure that I'm rising my hips and my chest at the same time. So that's the other way. If no one is really watching you, just video yourself so you can get some feedback from that.
I may have said this wrong, but I think they mean like
how to drop the weight.
Yeah, drop, like when you're releasing the weight, to drop the weight.
I thought you meant take the weight out.
No.
For what movement?
Anything overhead.
Let's go to the two that you guys have done today, the squat and deadlift.
All right, so if you're
in the squat, if you're even attempting something that you think is heavy for you, you should at least have a spotter, and you should have safety racks. You should have pins, anything to catch that weight. We don't want it hitting the ground. We don't know where it's going. Weight always wins in the gym, right? I learned that from kettlebell training. When you're doing a back squat, you should fail backwards. Don't go forward. It can get caught on your neck. It might tumble you forward. The worst thing that happens is you hurt your neck, and we don't even want to think about those things. So if you're gonna fail a big weight, just jump backwards, go forward.
I think deadlift is pretty straightforward. You're just gonna drop it down. If you're talking about overhead, always push it forward and let it fall in front of you.
Weights always win.
Yeah.
Get out of there. Get out of there. Weights always win.
I think that answered it. Thanks, guys. The next one, do you have any recommended stretches to help recover after low back pain?
I've been saying a lot.
I think my favorite, and those that my patients really like, are like very simple cat-cow, especially if you had like a really acute sharp pain that you can't even like sit. I find that cat-cow just kind of helps to loosen it a little bit better. So the cat-cow one. Child's pose is also really good, just to make sure, just to like drop your hip all the way down, try to get all the way down to your heels, and just to really loosen that lower back a little bit. And another one I like to do is pigeon stretch. So it's like the glute stretch. It just puts your hips and your back in a position where it has to relax. If not, it's gonna be really painful if you don't. So I like those. Do you have any?
I would just say, more from like a physical therapy standpoint, just make sure you know what's going on first. So like a lot of the things that Jill talked about is like thoracic mobility. Like even though you hurt your back, just working a lot of that thoracic mobility, kind of automatically working a little bit of the low back, getting the hips involved and moving them around. But we won't really know what's wrong and what's good until we can evaluate what hurts. So my biggest advice is, sure, you can start with some stretches, especially if they're not painful, but go get evaluated because, and like I said earlier, seeing a physical therapist sooner rather than later, know what the problems is.
I agree.
And this may be a similar response from you guys, but I hurt my back at CrossFit a few days ago and it still hurts. How long should I hold off returning to CrossFit?
Come on, man. Are you in LIC?
Let me scroll through and see if we have any other ones.
Well, I didn't even answer the question. I would say, well, see a physical therapist. Like if the question is to, ooh, am I frozen? Am I frozen, guys? Am I frozen?
You are frozen, but we can still hear you.
Okay, wonderful. If the question is to see or not see a physical therapist, there is no harm in seeing the physical therapist. If the question is how long should I wait to participate in some sort of activity, go for it. Go for something. Like obviously don't go to the gym and deadlift max again, right? But go to the gym, get some blood flowing. Just the fact that you can get some blood temperature up, heart rate up is gonna facilitate a lot of like anabolic hormones for you, stimulate the healing process, and then wait for those symptoms to come down. So once you can move confidently and proficiently, then you can start loading up again. But don't let an injury, like I said, like bed rest, avoiding all activities, that's gonna kind of suck in the long term.
Rest is rust, guys. Motion is lotion.
Is the potion.
We have another question. What's the difference between a deadlift and a squat in terms of muscle activation?
So I think as we went through just now, the squat and the deadlift actually has the cues to how you move are actually completely different. The deadlift is definitely more targeted on the posterior chain, meaning your lower back, your lat, and your hamstring. And actually, I mean, the squat too, it's also like whole body, but I think the deadlift is specific for like posterior chain. And there's actually not that much hamstring activation in squat, right? That's what they found. Yeah, there's actually not too much hamstring activation in the squat at all. So it's actually targeting two very different muscles. Both work on the core really well though. Both load the spine just in a different manner. But in terms of hamstring, the squat doesn't really activate the hamstring at all.
And, yeah, and just to throw on, squat obviously gets the quad a little bit more.
How do I know how much weight to use for each exercise in CrossFit?
You do CrossFit.
If you're a CrossFitter, those of you who do CrossFit know that there's the RX weight, which is the prescribed weight, and then any other weight that's not the prescribed weight is the scaled. I always try the scaled first. I feel like the coaches actually generally give really good feedback on what weight to use, but if you are warming up with the RX weight and you feel like you're not gonna make it, don't use the RX weight. Just always find a weight where you can kind of manage, like I think 70% about that is actually a good weight. It really depends on the squat, on the WOD. If the WOD is really long, then obviously you want to bring the weight down. If the WOD is meant for strength, then obviously you want to bring the weight up a little bit. So it really depends on what the WOD is targeted for.
Random. This is kind of a question for you too. Isn't there good research out there that says like going back and forth between the scaled and like yes. RX like that? Like if you're a type of person who goes back and forth between the two, that just increases injury risk. So
pick one and stick with it. Don't switch around. The highest injury rate is when you're actually at like a pretty good scaled option and you're trying to jump to the RX weight. That is where people get injured a lot. So go really slowly, and if it's not necessary, just stick to the scale. Yep. Right. Thanks for reminding me.
What's the difference between the front squat and back squat, or high bar squat versus low bar squat?
Okay, so moving from forward to back with what you just said, it's going to load the spine differently. It's going to load the knees differently. It's going to load the hips differently. So starting with the front squat, we're loading the knees a lot more. We get to keep an upright chest. So we can drop a little bit further into the squat and we get a lot more torque around the knees. So it's a good way to train your quads if you're finding that your quads are lagging a little bit. The high bar squat is kind of like the hybrid. So putting the bar across the top of your back is going to still activate a lot more quad. You can still drop into that really low position. And then a low bar squat is when you put it kind of across your scapula more along the rear delt area. And in that one, it's kind of a completely different movement. And the goal of it is to hit the most amount of weight possible. You're putting a lot more force throughout your low back and your hips. And even though they're very strong, like they can handle it, but it's just a completely different movement. So most force on the back is the low bar squat and working towards the front squat. The most on the knees would be a front squat and working towards the low bar squat. And then, yeah, those two things are kind of like inversely related with the squats.
All right, I think we have time for one more question. And it is, do I need to already be in shape to start CrossFit?
The answer is actually no. So I wasn't super in shape when I started CrossFit. I think one misconception is like, oh, I guess it's what CrossFit looks like. People think that they lift crazy things all the time, but actually you can modify the movement as much as you can, and build yourself up slowly. So for example, me, I was so weak, I couldn't even lift the bar. The bar itself is 35 pounds. I couldn't lift it the first time I joined CrossFit. So I would say no, you don't need to be super in shape, but you do obviously want to tell the coach that, hey, I'm a beginner. And generally CrossFit gyms have that beginner course where they go through each movement with you, just so you know the movement, just so you're making sure you're doing it correctly before you even start going for the WOD. So yeah, I think there's a lot of scaling options. And if the coach sees that you're not able to do like the amount of skill that's needed, they always modify it. So no, I think anyone can start at any time. We just need to be really careful. And then if you have any pain, you just need to tell the coach.
Awesome. Well, thank you, Jill and Martin. So we hope today's talk was valuable and that you guys now understand a little bit more about low back pain in the fitness athlete and better understand the correct movement patterns that we should be achieving when we're doing these exercises. As a reminder, your presenters today were Martin Del Prado and Jillian Lye, from our Long Island City location. Please feel free to jot down their contacts and information if you want to reach out directly to them for any questions. Also, our Q&A moderator was Ryan Coy from Midtown Plaza Hotel location. Also, please feel free to reach out to him with any questions or interest in appointments, and he can help you get set up with any one of our PTs. Lastly, at Spear, we will continue to host webinars throughout 2021, covering a variety of topics. So we look forward to seeing you there. Please follow us on social media and check your inboxes to learn more about the upcoming topics and schedule. Thank you so much for spending time with us today. We hope you enjoyed the webinar. We'll see you later. Thank you.